My name is Ramin Nilforooshan. I'm consultant psychiatrist for older adult, dementia specialist, and professor at the University of Surrey. And I've been PI and CI for many dementia trials. Psychologists could play a major role in being a center to communicate with other healthcare professionals. Many people with dementia, they have many other comorbidities and they require different hospital appointments. Many of them, they have diabetes, COPD, asthma, cardiac disease. And then they go and see different clinicians, and every clinician prescribe medication based on their specialty. I think it's important for psychologists to provide a program and care plan that when a person goes to see a cardiologist, explain to them, this is how you could engage with the person, this is how you could understand their behavior and character better, so you could provide better care. Otherwise, a person with dementia goes in hospital, stay in a queue to be seen in an outpatient appointment, they get agitated, then they may become aggressive, then the specialist won't see them, the problem is not solved, they come back home, and they may have consequences because they were not seen by their specialist. So it's helpful that one person link with everyone else that involved with the care of the person and be a center that communicate well, provide this PBS for everyone else. It could be a simple thing that just ask them to sit in a quiet room, not with others, or the specialist go and see them in that room rather than bring them to a clinic which is full of devices and the person may get confused or be scared. So psychologists could play a major role. Definitely, because I think when it comes to psychiatrists and neurologists or geriatricians, what we usually do is prescribing medication. And as we know, prescribing many medication for people with dementia doesn't really solve the issue. Many of those challenging behavior, they settle down if the environment is right, if the approach is right. And therefore, I think it's important that the role of psychologists get established, and maybe they could be part of care pathway leaders, and they lead in that part of a journey. Because I think we need different people with different part of this pathway and journey. Obviously, if the person is interested in older adult, then the dementia is a big part of that. But looking at the epidemiology of our community and how things are moving forward, and number of older adults in hospital, this is something that every healthcare professional need to understand, that dementia will be an illness or disease of the future and now, because 1 in 4 hospital bed is occupied by people with dementia, and majority of the cost of NHS goes towards dementia care. So we need more people, and definitely psychologists, they play a major role in this. Psychologists could speak in a plain language with the carers, that sometimes what they need to understand about the dementia care. Because some of the specialists in dementia, they're very good in making a diagnosis or provide a treatment. But when it comes to giving day-to-day advice and how the carer could cope with some of the day-to-day challenges that they have, I think psychologists are the best people to tackle this. For example, many people with dementia, they repeat a question many times. And carers, they get sometimes frustrated and they don't know what to do. And I think it's important psychologists explain to them how you could change the topic, how you could answer this in a different model, how you could provide some cue about what day is it, what time, or something else. So they could engage the carer in providing better care for a person.